is ready. We're ready for our new panel. It's a very important topic, particularly in the last 5-10 years in our country. We see this tremendous increase in health tourism. Our new topic is the potential of healthcare tourism and using its potential, wellness and therapeutic investments. As we talk about using the potential of healthcare tourism, what are the headings? We're going to talk about the growing markets in healthcare tourism and the wellness travel investments. Güven, Healthcare Group President Banu Küçükel will be moderating this session. Banu Hanım will be moderating the session. Our panelists are Dr. Mehmet Altuğ from Lokman Hekim University. He's the director of the Board of Trustees. Professor Orhan Gazi Yiğitbaşı from Medipol University. He's the medical director. Reşat Bahat, the president of OSAT.
Ömer Tosun, INDIGO Group Başkanı.
Ömer Tosun, the head of INDIGO Group. Welcome, Ömer Bey. You're always very well dressed. Banu Hanım, I'll give the floor to you. Have a good panel. Thank you. Distinguished guests, distinguished TIF and Organization Committee, we are the representatives of the Turkish healthcare sector and we're very happy to participate in the forum of this tourism sector. We believe we're going to bring new excitement to the tourism sector and we're going to discuss the possible collaboration partnerships with you. We have very distinguished panelists. Before I introduce them, I want to say a few words about how medical tourism started in Turkey. About 25 years ago, there were some leading organizations and they wanted to have international accreditation, and there were very important structural transformations to be part of that. There was this intercultural situation to serve the health of tourism. The private sector got deeper, and we have health tourism in our country. It's a $4 billion of exports of Turkish healthcare sector in Turkey. What kind of a medical destination Turkey will be, what needs to be done. We have very important panelists to discuss this today. And with the tourism sector, how can we bring in other health functions, well-being, wellness, senior care? We're going to be discussing those. Dr. Mehmet Altuğ is from Lokman Hekim University. He is the head of the Board of Trustees and he is also the president of DEİK. Orhan Gazi Yiğitbaşı, he's from Medipol University. He is the director of medical services. At the same time, he is in the board of service exporters. Dr. Reşat Bahat is the president of the board of Bahat Hospital Group. And he is the president of private hospitals. Ömer Bey, you know him very well. He is the president of INDIGO, and at the same time, the first thermal tourism investor in Turkey. He is a pioneering investor in thermal tourism. I want to start with you, Professor Orhan Gazi. Service experts. What is the situation of the Turkish healthcare sector in this field? What about the common working principle with other parties? Can we create a synergy? Thank you. I believe that we have 40 years of experience on this stage. I'm talking about the average of this stage, right? Ömer Bey, 50 years. So 40 years of experience is incredible experience. So I'm very happy and honored to be with you on this stage. When we talk about service exports, there is healthcare and thermal tourism included. This is an umbrella which covers tourism sector, healthcare, education, software and IT technologies, passenger transportation, port management like airports or seaports, financial consultancy, contracting services, logistics. So it is about 8 to 10 different sectors under this umbrella. You may think, let's discuss healthcare and thermal here. What about the other sectors? What's the point? What's the relevance? Well, there is a very strong relevance. For one thing, a tourist is not just someone who travels and goes back. There is a wealth of demand recently. So, a tourist wants a comfortable plane and a cost-affordable flight. They want to eat something unique and tasty. They want to have some cultural richness as they travel. And they don't stop there. I want to feel this wellness state, like mind and body refreshed. Let me just recover. When I go back, let me restart fresh. So the tourists have such demands today. And it's not just the ordinary tourist that has this. Our patients have similar demand for this wealth of services. It's not just about having a surgery, use medication, and recover. They say, Doctor, what can I eat and drink? How about my sleep? How about my exercise? Can I have a massage? Can I have some thermal services? That's what the patients want. They have these incredible requests today, and they don't stop there. You know, and when I'm at home, I want to have telemedicine service. Give me a wearable device so that I can have my tests there. So actually, these seem to be like patient or tourist demands. But when we look at our relationship with other countries, the countries are not like, let's send you a patient and help them recover. It's not limited there. They say, educate my patient, educate this person. And I want to have educated people employed in my country. Build a hospital here. That's what they say. Establish software here. Give me financial consultancy. In the beginning, I listed the sectors. They seemed very irrelevant or disconnected. But when you think of all these demands, it includes contracting, logistics, IT, gastronomy, passenger transportation, everything. So we need an integrated business model. We have this obligation. It's a competitive environment, and that's going to bring some privilege. Whoever responds to this demand, they will differentiate themselves. Let me give some examples. It's not just about the healthcare sector. Turkish Airlines comes to us and says, I have 1 million tourists per year from the US. I want to increase it to 2 million, but I want to offer them an attractive package that includes healthcare, like a birth package, a checkup package. And I work with Hediye Hanım. Let's have a hotel service included. So there's hospital, hotel, Turkish Airlines involved in this example. You can include the port management here. So there are so many business models that we need to create. So an integrated business model is what we need. Individualized medicine, integrated medicine, it also invites that. So we should together be prepared for a new business model and come up with its examples. I'll wrap up in a few sentences. It's not just about making money. That's not the right thing. When you think about it, there is senior care. People want to age healthily. So when you have this integrated business model, you can actually support global health, and you can expand that further. Biological diversity, ethnic, local, vegetable, animal, endemic profile, the local values, the natural wealth could be included in this. So it could be this sustainability theme that is integrated in these models. So when you look at things from this perspective, there is an incredible synergy and potential here. Thank you. Thank you. I believe the biggest synergy will be with the tourism sector, especially senior care, thermal care, and longevity. Okay, then I'll turn to Reşat Bey. Where is the Turkish healthcare system? Can you share its situation? Can you take a snapshot? Where are we strong? What do we need to do? Why do people come to Turkey? Let's first discuss that. Is it because they love us? Yeah, I'm sure some people come for that, but I want to talk about the private sector in Turkey. There are about 600 private hospitals in Turkey, and there are about 2,000 medical centers and special private centers, and there are about 1,000 public hospitals. In healthcare sector, 1.5 million people work. About 500,000 of them are in the private healthcare sector. In Turkey, there are more than 50,000 beds of the private sector, and 40,000 specialists work in the private healthcare sector. The private healthcare sector mostly are university hospitals or affiliated with university hospitals. And differently from other countries, in Turkey, the private hospitals are not doing the crème de la crème work, from liver transplant to heart transplant, from bone marrow transplant to hand transplant, large cancer treatment, radiotherapy. They do all sorts of things. Whatever is done in the US is done here at a more economical and faster way in Turkey. So they come to Turkey not by coincidence. For the last 10 years, Turkey is in the top 10 in healthcare tourism. It's not the 8th or 9th. We're ranking the 3rd or 4th in the world. And where do you want to go in the world? That's what they ask to people, and Turkey ranks the 2nd in healthcare tourism. This is a major achievement, but it gets stuck at a certain point, healthcare tourism, because we need diversity. We need to create diversity. Of course, we have Turkish Airlines and Pegasus. We have Istanbul, Ankara, Izmir, Adana. We have these brand cities. Of course, we have very hardworking people. 50% are younger than 34 years of age. We have this great population. It may sound weird, but in Turkey, the foreigners who come to Turkey, there is this irregular migration. It has a plus for healthcare tourism. I have to underline that. We have every foreign language spoken in Turkey. Like, you may employ people who speaks the local languages of Somalia. It's an advantage for Turkey, but, you know, like the president said, it's $4 billion. That's where we get stuck. So we need to talk about new things. That's why I'm so excited. We need to talk about new things with the hotel people. We need to be disruptive. And we have to include healthcare and education and wellness included in the picture. Hydrotherapy. And inside hotels, we should be more involved in the hotels, because when we offer hotel services, we have a lot of difficulty because this is not our professional job. We offer hotel service because we have to. But Our hospitals are not designed that way. My group only, we come from a hotel background. Ömer Bey, I think we're paying back. My group has 3,000 accommodation built for hotels in Turkey. People come for healthcare tourism, and I think this is a great synergy. So we're in a very lucky geography. We have a very young population. We have very crazy investors. After the US, the highest number of accredited institutions, hospitals are present in Turkey. They have international accreditation. This is not a coincidence. Maybe it started off with a coincidence. I don't know if there's any rationality involved, but now there is a rationality because this size cannot be managed without an algorithm. Thank you very much, Reşat Bey. Yes, President. You have your day hat, and in healthcare tourism, who are our competitors? What you say is very important. We're very curious to hear that because you also developed the economic policy together with DAIC. Let's listen to you. Thank you very much. Both participants touched upon several issues. The point that Turkey has reached in healthcare tourism is not a coincidence. We're in top 3, top 5, top 7. We are ranking at those levels, and this definitely has a foundation. I will continue from where Reşat left. This is not a coincidence. In Turkey, the healthcare infrastructure, the education, service delivery, it's very good. We already knew this, but after 2000, Turkey opened up to the international area, and we realized that we're very good in healthcare. We have great healthcare professionals. And in fact, when it comes to healthcare management, we're not bad at all. We had the chance to see this. So when we were in the world arena, we have a very good ranking in medical tourism today. We have talented and experienced healthcare professionals, but in 25 years, we also had the healthcare quality systems. Our legislation is now appropriate. We have the national and international accreditation. So the concept of quality is now in our hospitals, even in the remote corners. And we have high level of patient satisfaction, which is very important. We call it customer satisfaction in different sectors, but in our case, we have patient satisfaction thanks to this quality healthcare services. And it's not just because of the affordability that people come to Turkey for healthcare tourism. They know they will get a quality service. They know that there is a certain quality standard. That's what they know as they come here. Of course, the costs are affordable. That's important. And the tourism infrastructure as well. Maybe we should talk about this more here today. This collaboration, this attraction should be expanded further, and we should see how we can capture this synergy further. We have reached an important level at the healthcare sector. How can we make it sustainable? This is an important question. We hear the word sustainability in a lot of meetings. We discuss this in our companies. It's a very topical issue. So how can we sustain it and carry it higher up? I think the tourism infrastructure is very important in that regard. Of course, in hospitals, we are a service sector. Tourism is also a service sector. So we are actually doing cleaning, food services, security services. Actually, there are several services that we offer. So how can we package and serve this? We need to increase the synergy, I think. Of course, as we do this, we said we're ranking the 3rd, 5th, 7th, but our competitors are doing things too. Which countries are they? Particularly India. Perhaps India is one of the most important competitors of Turkey, and recently some European countries too, because a lot of our patients come from the Middle East and Europe, and some European countries are now focusing more on healthcare tourism, like Bulgaria, Portugal, Italy. But still, we don't see them in the top 10, but they are among regional competitors of Turkey. There's South Korea, Malaysia, Thailand, and China, of course. Like in several other sectors, in healthcare sector too, they're among our competitors. How can we compete with them? Well, sustainability is very important. At the end of the day, high patient satisfaction matters. We have to use all those arguments very well, because it's not just the good treatment of the physician that satisfies the patient. The other stakeholders should also work towards high patient satisfaction. So that's how we can compete with the others and be ahead of them. Thank you very much.
Ömer Bey, actually, you do something from which we have a lot to learn, thermal tourism. We have this perception in Turkey, we limit it to the concept of spa. The perception is a little bit different in Turkey than the examples in Europe. Do you think we can position this spa business differently? How can we carry it to a higher segment? A very good question. I would like to thank the President and my colleagues in the Executive Board. I would like to thank them for organizing this event. It's a great event, a great organization. For the past 2 days, we have been talking about sustainability, which is an important part of tourism, right? We have talked about diversifying tourism. Today I learned something. Mehmet Erdoğan, an esteemed colleague, talked about it. This is something that we have to reflect upon. What is it? United Arab Emirates bought a land of $2 million from Iskenderiye, and they are building a large campus there around Antalya. What have we said over the years? Tourism in Antalya can be competed with. We have to bring our own values and diversify tourism there. We have to do something that is in the highest segment. We have the required experience. We have everything in terms of our colleagues in the field, in terms of investors. I am the head of the Geothermal Investors Association. I'm also now the head of the Cappadocia Tourism Investors Association. There is something I believe in. If you do something, you have to do it in a unique way and in a high quality way. These two things are very important. What is our difference? We are rich in terms of history, in terms of nature. We have everything, but there is something very important. We have the most important geothermal resources in the world. So if you look at this map, all of these dots are the currently discovered geothermal resources. So we can become the number one in the world today. But we have spa, centers, and we have a hotel in Afyon. We have a couple of hotels in Kızılcahamam, in Kozak, in Nevşehir. But we can go beyond that. This is not what we're focusing on. What we're focusing on is that we can have luxurious thermal tourism investments in Turkey. What do we need? We have the nature in Van, in Elazığ, in Bitlis. I've been there recently. They're amazing. There's all kinds of infrastructure. The state invests in them. We have roads, airports, hospitals, universities, personnel to work in that region. Therefore, we have everything that is required for tourism investments, but what do we lack? Investment. So we have to lead the way, pave the way for tourism investments. We have to create this new space there. I have been in tourism for 51 years now. Sometimes it's an advantage that nothing has been done in that region. We have not gone beyond spa centers, but our reputation is there. So if we make investments in the highest segment, we can be successful. This is what we explain to the government. We bring projects to the government. We say there are 4 main factors in the 12th development plan, and 3 of them are connected to geothermal. Therefore, we ask for their support. We say sustainability. Well, what do we have in a thermal center? First of all, you attract tourists. Secondly, it's a health care center. Thirdly, as this is a thermal center, it heats itself, it cools itself, it can have its own greenhouse in terms of sustainability. It can create employment, it can contribute to the development of that specific region. There is so much to talk about. This panel cannot even suffice to explain all of the advantages. This can be a whole different independent panel. Maybe next time. In terms of diversifying tourism, in terms of the development of our country and improving our competitiveness in tourism, we must invest in luxurious thermal tourism centers. I would like to thank you, dear investor colleagues, dear young people. This is something we have to focus on. Our association focuses a lot on this topic. Thank you very much, by the way, for giving me the opportunity to talk about this. I believe this is one of the most important topics in Turkey's tourism. We have top-notch hospitals that provide healthcare services, and they have enormous network. They have a great customer potential. For example, in Elazığ, there is 13 museums. It's amazing. It's unbelievable. Whoever is the mayor, I would like to thank him. If I will do that if one day I meet that person in the mayor in person. A hotel, a thermal facility there, maximum 80 rooms. And if you collaborate with a hospital, a Güven hospital, for example, whatever, you can bring a foreign brand or a local brand. You can use their customer potential. Then why wouldn't tourists come there? There's no reason why. And the local people are amazing there. Yes, I know that I have to wrap up. Maybe next time I can talk about this in detail. Thank you very much. Let's have the last round, and I would like to have these last words in a free manner. Maybe we can talk about elderly care, maybe we can talk about how to increase exports, how we can improve medical tourism with the tourism industry in general. I'm not going to ask specific questions one by one. I'm going to give you the word so that you can talk about it freely. Well, let's start with you. Healthcare tourism is on the rise. Not only the demand for Turkey, but in general in the world, there is an increasing demand for healthcare tourism. As President Banu said before, the demand in the healthcare sector is becoming different. This is going beyond the classical, the typical healthcare services that we provide. It's diversifying. Therefore, healthcare investors like ourselves must revise their services in terms of international service provision and in terms of international patients, international people. How can we attract them to Turkey? Well, they're hospitals, but they include and involve wellness as well, home care, elderly care, longevity. Maybe this can all be a package. Well, as you say, we can call our facilities in a different way, in more generic terms. Digital transformation and technological investments can be involved. Our government, our ministries can view this from a different perspective. They can apply positive discrimination here. And target markets do not have to be close. We can go further. We can revise our target markets. They could bring more opportunities. And finally, I would like to touch upon human resources. We are in 2024, soon 2025. Human resources are the most important type of resource. So this is where our investments should go. Education is vital. I believe that the main reason why we are in such a good point in healthcare tourism is because of the quality of healthcare education. In general, the education is doing very well, in my opinion. I am a representative of a university at the same time. We can transform so many things. But if we evaluate ourselves in the world arena, I believe, especially in healthcare education, we're at a good point. We have to make very good use of it. And we have to reflect more upon how we can attract more tourists to our country, more healthcare tourists to our country. Great, thank you very much. Well, dear Professor, when we go abroad, especially in European countries, well, actually everywhere in the world, there is long waiting periods in the healthcare sector, and the population is getting older in a fast manner. And we see that there is not a sufficient number of healthcare professionals. So can we say that everyone will come in one way or another to Turkey in the upcoming 5 to 10 years? Well, that's very correct. Even if there are certain obstacles, this sector is on the rise. No one can stop it. Healthcare tourism in this country is going to get stronger every day, and we can make it even faster. There's some things to be done by the government, more supervision, accreditation systems, quality systems. The government should orchestrate this very well. I'm not going to go into detail in this panel. In the private sector, integrated business models should be developed, and we can open hospitals, facilities abroad. Well, these are different issues, but what I would like to underline here is as follows. The main theme in this meeting, in this event, is tourism. Services sector has great potential. Some figures. As you know, good exportations in the world was in negative numbers, and in Turkey it increased 6 per thousand, but it was 5% in negative terms in terms of good exports in the world, but in Turkey it increased by 9%. Turkey is now aware of it. We are making losses. We import goods, which means $70 billion of loss in goods. But in terms of services exports, we had exports of $126 billion, and more than half of it was net profits. Actually, figures show us where our investments should go. And as you know, Turkey has now decided on it. The ministry is providing incentives. There were 380 companies that received incentives. Last year, it was up to 850. Now it's 1,300 this year. So the state is giving incentives here. And finally, we have such valuable brands. For example, Istanbul Airport is the first in Europe. Turkish Airlines is the third. Contractors are the second in the world after China. In terms of soap operas, 800 million people are watching our productions in the world. Therefore, we have world-class brands and services in all of these areas, so this opportunity must be seized. Thank you very much. Well, now I would like to turn to Mr. Reşat Bey. What are the investment potentials in the healthcare sector in Turkey? Now that we have all these investors here, what are your recommendations? Turkey is a very special place, and we have significant brands in the healthcare sector. We have seven giant healthcare brands that make investments in the world. And in the past 5 years, they have opened up 30 hospitals abroad. So healthcare professionals that make investments in Turkey, they're not limited to Turkey. This is not how we have to see them. In Europe, in Africa, in Asia, they have a great reputation. Turkish healthcare sector and tourism sector have good reputation. Turkish doctors have great reputation. So this healthcare brand in Turkey sells now. We have certain limitations such as planning, but I believe that with the new minister and with the rising number of doctors, these limitations will go away as well. Healthcare is a very well-defined business where there is no informal work, especially in hospitals, in big facilities. So we have great universities. Well, healthcare system has a problem in terms of producing science. This is related to affiliations, actually, but I believe this can be solved too. Well, I would like to give the floor to Ömer Bey because I'm very pleased to hear his ideas. Well, Ömer Bey, you have been in the tourism industry for 51 years now. Where do you wish to see the healthcare business? Where do you wish to see it based on your life experience? Where do you want to see the healthcare tourism industry? Well, first of all, let me say that you are very successful, but if I keep saying that you're successful, this might lead to laziness because there are so many things to do. In terms of the luxurious thermal facilities that I talked about before, with its contribution, healthcare industry can become even more powerful. We talk about competitiveness with India, but India does not have what we have. Who can compete with us? Mexico can. Indonesia can, for example. So luxurious thermal tourism investments are important. Turkey must have that. We have investors here and those who wish to invest, so I would like to say it here. One of the most important tourism branches in Turkey will be luxurious thermal tourism investments. There is great potential. As the Association of Geothermal Investors, in May, we are going to have a summit on the 9th of May. We're going to talk about everything that's related to geothermal, and we're going to allocate one panel to this issue specifically. We're going to talk about investment opportunities. By the way, we're working with the government to overcome the shortcomings. There is this success of the healthcare industry. If we combine it with thermal, in that case, we can create a great potential. We have to see that as tourism people, tourism professionals. This will be beneficial in my opinion. I would like to thank everyone for their patience. And thank you, our moderator. Thank you very much. What you say is important. There is this seasonality in the tourism industry. Winter is the low season. This can be a good solution to that, to seasonality. And this will expand tourism over 12 months. Employment will be extended over 12 months. What is our biggest problem in tourism? We have personnel for 6 months, but then we cannot keep them for the remaining 6 months. If we have these facilities up and going only in winter months, we can transfer personnel to such facilities in winter. So we have to work on this very hard. As the executive board, we are generating ideas. We are trying to build a new concept. I have an esteemed professor here, Tümay. I would like to thank Tümay as well. There are a lot of people working on this issue. So if we work together with the healthcare people, I believe we can solve this issue very quickly. I also would like to thank Hediye Hanım. She's our leader and she's a member of our association. Thank you very much. I would like to add one thing on what Ömer Bey said. The Ministry of Health has a regulation, clinical hotel regulation. They require hospitals to have clinic hotels by 40% of their bed capacity. We must be able to open up such clinical hotels together. The population of elderly is increasing, so we have to work on this. As healthcare professionals, when we go to Ankara, they misunderstand us sometimes. They believe that we're going to disrupt the planning, but we have to focus on this clinical hotel business. This is a business that is going to grow. Thermal is a good space to develop that. Let's work on that now that we have the regulation. I am sorry, but I would like to say something about that. This is very important. People are getting older in the world. Imagine that you're building facilities for them in a calm environment, thermal facilities, pools, facilities for care. So we have to think out of the box here. We have all kinds of potential in our hands. I know that what you talk about is done in India. It's great. Well, you come from Ankara, Reşat Bey. Ankara is working on new regulations about geriatric services. Well, they can expand it to these clinical hotels as well. Thank you very much for listening to us, for your patience.